Hello nurses and hello world, this is Nurse Sam and welcome back to my channel. And yesterday I'm going to show you how to pass your station, which is the peak expiratory flow rate station. This video is solely for demonstration purposes only, as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden 10th edition. All information presented are public domain materials accessible to the relevant governing organization's website. Subtle similitude may be noticeable. However, this is not intended to be definitive guide to the NMC Part 2 Test of Competence or the OSCE examination. This can be helpful materials for overseas nurses or internationally educated nurses to learn and adapt to the UK clinical setting and transition effectively into practice. You have 8 minutes to finish this station. According to the marking criteria, the examiner will tell you that ID check and consent has been done. So all you have to do is to perform the procedure. Careful nurses, you will fail if you incorrectly advise the patient regarding the positioning of the peak flow meter, or if you have given an incorrect procedure to the patient, or if you have given an incorrect technique. Also, at the end of the procedure, you will have to document. So if you didn't document, then it's gonna be a major fail. In this procedure, you have to perform a reading, a peak flow reading, and compare it to the normal values of the peak expiratory flow rate. But I will explain that to you later. And by the end of the examination, you will have to document, okay? If it's not documented, it's not done, okay? So make sure that you document on this procedure. Shall we start? Before we get into it, please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more OSCE videos, then hit the notification bell. And if you want to ask me any question, if you want your question to be popped up to the top and I'll be able to see it and answer or reply it as soon as I can, then hit the join button and become a member. Alright, let's go. First thing I'm going to do is I'm going to wash my hands using the steps of hand washing in accordance to the World Health Organization. First, wet your hands. Obtain some soap. 5 backwards and forward stroke from palm to palm. Right palm over the left dorsum and vice versa. Fingers interlaced. Fingers interlocked. Rotational rubbing of the thumb and vice versa. Rotational rubbing of the palm with finger clasp. Rotational rubbing of the wrist. Now rinse it thoroughly with water. Pat it dry with clean towels and dispose it in the domestic bin. Now I'm going to prepare the materials, okay? So I got here a disposable tray. Miss Examiner, is this tray disposable and ready for use?
Yes.
Okay. The next one I got here is the peak flow meter, making sure that the gauge is working. Miss Examiner, is this peak flow meter calibrated and less than a year?
Yes.
Clean and intact. Okay, I'm gonna put it on my tray. So the next one I got here is a disposable mouthpiece, clean and intact. However, there's no expiry date. Miss Examiner, is this within expiry date? Clean and ready for use?
Yes, it is.
Okay, I'm gonna put it inside the tray without touching the key parts. Next one I got here is the alcohol swab. 70% alcohol, chlorhexidine, clean and intact. Expiry date is 11/20/29. I'm gonna put it here. And that's all the things that I've needed. Also, I'm gonna need the normal peak expiratory flow rate. Of course, this is just a copy of this one. I want it bigger, so I will be able to explain to you how to get the normal peak expiratory flow rate of the patient later on. So I also have it as part of the materials here on this trolley. Okay, so I'm gonna put it here, and the prescription, which I am going to show you on the screen right over here. So I'm just gonna have here a sample prescription. I'm gonna put it here as part of the materials. Okay, pair of clean gloves, and I'm gonna wear now my apron. Gel my hands and let it dry for 30 seconds. I'm ready to go now to my patient. Now to the patient side, bring the trolley near the patient, making sure that the scene is safe. Provide privacy and dignity by closing the windows, the doors, and the curtains. Let me just gel my hands. Let it dry for 30 seconds. Hi, my name is Giselle. I'm going to be your nurse for today.
Yes, hello.
Since ID check and consent has been done, I'm not gonna do that anymore. So I'm gonna proceed now with the procedure. I am here to check your peak expiratory flow rate, in which I need to check your lung capacity, if that's all right.
Okay.
Happy for me to proceed?
Yes.
Okay. Are you comfortable sitting there? Do you have any pain at all?
No, I'm not in pain.
Okay, so I'm gonna proceed now, okay?
Okay.
Alright, so before I start, I just need to check. You done any peak expiratory rate assessment before?
Yes, I've done this before.
You have, can you tell me your previous result?
I think it was 340.
340, okay. Don't worry, we'll get you the latest one today, okay? Do you still remember how it's done?
I'm not so sure.
Okay, don't worry, I will teach you how to do it, okay? Okay, before I start this procedure, I just need to ask, do you have any nebulization or inhalation?
No, I don't have any.
Okay, because if you have, then you have to check your peak expiratory flow rate 30 minutes before you have taken your inhalation or nebulization, okay? Yeah?
Okay.
Alright, so let me just gel my hands. Let it dry for 30 seconds. Let me just wear my gloves. So this procedure requires you to be in a sitting position, which I am happy that you are already on a sitting position. Are you comfortable like that?
Yes, I am.
Okay then. Okay, so this is the peak expiratory flow meter. Yeah, and this is the mouthpiece. Just attach them together without touching the key parts. There you go. Alright, so make sure that this gauge is on the 0. Okay, and hold it. Hold this one horizontally. Okay, here's some steps that I need to tell you because these are very important. Make sure that your finger doesn't impede the gauge, okay? Make sure that your fingers doesn't impede this gauge, alright? So make sure it's like that, okay? Once you've done that, I need you to take a deep breath through your mouth in full inspiration. After taking a deep breath, immediately place your lips tightly around this mouthpiece, making sure that there's no escape of air. Okay? So the inspiration should not be held longer than 2 seconds at a total lung capacity. Afterwards, I'm gonna need you to blow a short, sharp puff as forcefully as you can in this mouthpiece. Are you happy with those instructions?
Yes.
Okay, so after you've done a short, sharp half as forcefully as you can on this gauge will move. And so, you have to check the result vertically, okay? Eye level. By the way, before we do that, what do you want me to call you?
Just call me Apple.
Okay, Apple. Apple, are you happy to proceed?
Yes.
Do you remember the steps?
Yes.
Okay, so here you go. So since I have a mannequin right here, assuming that the mannequin already did that, which I'm gonna show you the video right over here. Alright, thank you so much. So I got here the result. I'm gonna read it. Eye level vertically. I got the result here. 400 liters per minute. 400 liters per minute. So what I'm gonna do is I'm gonna write this result. Before writing the result, I'm gonna ask the patient to rest in between the reading. So, Apple, I'm gonna need you to rest in between the readings, okay? So you can rest for a bit while I document, alright?
Okay.
So I'm putting the gauge back to 0 and giving it back again to the patient. Apple, we're gonna do the same thing again. This is now our second reading because we need 3 readings all in all. So I want you to do the same thing. I want you to take a deep breath in full inspiration. Then I'm gonna need you to seal this mouthpiece with your lips. Make sure that there's no air escaping, and your inspiration should not be held longer than 2 seconds at the total lung capacity. And I'm gonna need you to blow a short, sharp huff as forcefully as you can, okay? Happy?
Okay.
Alright, one more. So, again, you can rest in between the readings. So, I got here now the readings vertically. I'm gonna read the result. So, I got the result here, 420. So, I'm gonna put back the gauge to 0 while I record the result. Okay, now for the third reading. So, here you go. The same thing. Inhale. Take a deep breath in a full inspiration. Now, place this tight seal. No air escaping with your lips. And I need you to blow a short, sharp puff as forcefully as you can. So, I got here the result. 410 liters per minute. Okay, I'm gonna put it back to 0. You can rest now. We're now finished. Let me just write the result and check, okay? So, the highest. We are now done with the procedure. I just need to remind you that after the procedure, make sure you dispose the So detach the mouthpiece from the peak flow meter and dispose it in the clinical waste bin, okay? As for the peak flow meter, I'm gonna get now the alcohol wipes. Open it. And I'm gonna need you to clean it from the cleanest to the dirtiest. So now that it's clean, I'm gonna let it dry for 30 seconds. And this is yours now, and only you can use it, okay? So I'm gonna give it now to the patient. As for this, I'm gonna dispose it in the clinical waste bin. Remove my gloves. Put it in the clinical waste bin. Remove my apron. Put it in the clinical waste bin. Gel my hands. Let it dry for 30 seconds. So now, Apple, would it be okay if I just complete my documentation and to check and compare the values to your normal values for peak expiratory flow rate chart, if that's alright?
Okay.
Alright. So, we're gonna complete now the documentation, which I'm gonna put here in the screen. So, our first reading is 400 liters per minute. Our second reading is 420 liters per minute. Our third reading is 410 liters per minute. We just need to take the highest peak expiratory flow rate, which is, yes, 420 liters per minute. So at the moment, I am okay with this result because if there is more than 40 liters per minute difference in between the 3 readings, then I'm gonna have to do 2 more readings or 2 more blows, okay? Ideally, it should be 20 liters per minute difference in between the readings. So this is alright at the moment. Now, I'm gonna compare the values of this result into the normal values, okay? In accordance to your age, height, and gender. So now, let's check and compare the values to our normal values for peak expiratory flow rate. Alright, so now let's compare the values. From this patient information, we've got the name, the address of the patient, and then the date of birth. We will do the math. So it says here the date of birth of the patient is 23rd of the 12th, 1987. So this year is 2024. So the patient, what age is the patient? Correct. The patient's age is 36 years old. So that's the first thing we have to determine as we are looking for our normal values for the peak expiratory rate of this patient. So age. We have determined now the age, which is 36. So I'm going to put it here. 36 about here. Now that we have established the age, we now have to establish the patient's height. It's important to get the peak expiratory flow rate of the patient. So according to this patient details, the patient height is 167 centimeters. Oh yeah, as you can see from the peak flow chart, gender is also important. So we've got a patient named Apple Middleton. She is a female. So again, woman and then men. Going back to the height, it's 167 centimeters. So I'm just gonna choose this part right here. Alright, 167 centimeters. As you can see, there is a rainbow right here. We've got the color light blue, purple, red, or orange. I think it is orange, dark blue. The last one is green. So at the moment, 167 is orange. So we're gonna stay on that one. The age is 36. I'm just gonna put a line. So there you go. I have made a line going to orange because orange is our height, which is 167. So now that I made a line there, it stops here. I'm gonna make another line. So there you go. So according to this chart, nurses, can you please tell me the normal peak expiratory rate of this patient according to her age, height, and gender? Right, it is 445. Let's have a look. So this one is 445. Does that make sense, nurses? Yeah? Okay. So now that we have established the normal peak expiratory rate of the patient, that's how we are going to compare the values, okay? So I'm gonna talk now to the patient and give the results. Okay, Apple, so I got here the result. Your highest peak expiratory flow rate for today is 420 liters per minute. And your normal peak expiratory rate is supposed to be, according to this chart, is 445. So unfortunately, your highest peak expiratory flow rate result today, which is 420 liters per minute, is slightly lower than your expected peak expiratory rate in accordance to your height, your age, and your gender. So that would be 445. So your result today is a bit low. So I'm gonna report this result to the senior nurse or the GP to make sure that your record is updated and also for further management, okay? And I will advise you as well to do deep breathing technique in order to exercise and expand your lungs, okay?
Okay.
Alright. So now, Apple, the procedure is now finished. Are you comfortable in there?
Yes, I am.
Do you have any question for me?
No, I'm okay.
So, are you able to do it now for yourself, just in case you have to do the procedure?
Oh, yes.
Everything is clear?
Yes, thank you.
Okay, thank you. We are now done, and like I said, I'm gonna inform the doctor or the senior nurse regarding this, and I will get back to you, okay?
Alright.
Alright, so if you need anything, here is the call bell, okay? Don't hesitate to call, alright?
Okay.
Let me just gel my hands. Let it dry for 30 seconds. Also, since I have provided privacy and dignity from the beginning, I'm now gonna open the window, the curtains, and the door. I'm gonna wash this trolley with soap and water, and I'm gonna wash my hands with soap and water after the procedure. And just like that, we are now done with this procedure. I hope you learned something for today. Thank you so much for joining me on this video. Please give your support, or please show your support by giving this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more OSCE videos, then hit the notification bell. Comment down below what other OSCE videos you want me to do next. This has been Nurse Cecile. See you on the next one. Bye! And now we've come to our shout out section. I would like to greet congratulations to our new passers. We have got at Evelyn and Ensign 3917. Congratulations. Likewise goes to at Bruti Sai or Bruti Sai. Congratulations for passing your exam. Also to at Sunja Song 3692 from Canada. Would you believe that? We got new members of the team. The first one we've got is at Ralph De La Cruz. Hi there and welcome to the team. Likewise goes to Muhammad Siddiq. Hello there. I got one more here, Everett Mendoza. Hi and welcome to the team. Oh, let's add one more at Taufikat Lamidi or Taufikat Lamidi 1529. Last but not the least, we've got Chef Nurse Maria. Welcome guys, welcome to the team.